Hi, this is our 2025 QuESST Research Day submission. Our project is Enhancing Wound Care Management, evaluating the impact of an educational seminar on nursing practices at DMC SInai-Grace Hospital. Improper management of chronic wounds significantly contributes to prolonged hospital stays and readmissions, particularly in bedbound patients with pressure ulcers or other chronic wounds. Inadequate wound care, such as failure to turn these patients regularly, exacerbates these issues, leading to complications and increased healthcare costs, with the average cost of treating a stage 4 pressure ulcer and its complications reaching well over $100,000. Furthermore, chronic wounds show higher prevalence and mortality in underserved populations. A contributing factor to poor wound management may be a lack of knowledge, as 67.3% of nurses report insufficient education on wound care upon graduation. Effective wound management requires proper staging and the use of appropriate care products. This study aims to evaluate whether an educational seminar can enhance knowledge of wound care management among registered nurses and wound care specialists, potentially improving patient outcomes and reducing hospital-related complications.
Our objectives for this project were to collect data on the current knowledge on dressing types, wound care, and best practices in wound management among RNs and wound care specialists at DMC SInai-Grace Hospital, to provide nurses and specialists with an educational seminar on wound care management and assess for change in their knowledge base, and to apply these findings to enhance wound care management at DMC SInai-Grace.
To establish a control for this single-center prospective study, a digital survey was administered to assess participants' baseline knowledge of wound care management. The survey consisted of challenging questions that covered essential knowledge that trained nurses are expected to be familiar with. Study participants included wound care specialists and registered nurses employed at DMC SInai-Grace Hospital who are routinely involved in wound care. This included registered nurses from the emergency department and medical surgical units. Nurses not involved in wound care were excluded from participation. Participants were recruited based on availability and grouped accordingly for data collection. The intervention consisted of an educational seminar presented by a trauma surgeon with expertise in wound care management. Following the presentation, the participants completed the post-intervention survey to reassess their knowledge. Upon reaching a sufficient sample size, statistical analyses will be conducted to evaluate the effectiveness of the educational intervention. Specifically, changes in survey scores before and after the intervention will be analyzed to determine whether the intervention significantly improved wound care knowledge among healthcare professionals. One aim and emphasis we have is to increase our sample size to make the study more representative and reliable. We did this by making the educational seminar available through Zoom. We have 4 different sessions scheduled, offered on 2 different days, one in the afternoon and one in the late evening. Participants were instructed to complete the pre-survey prior to the education seminar. This was followed by the presentation from the trauma surgeon, and after this, the participants were instructed to complete the post-survey.
Here is one example question from the survey showing how we assessed wound care knowledge. This is some of our preliminary data showing the scores from before and after one of our educational seminars. At a glance, this data shows an increase in scores, demonstrating that the nurses improved their understanding of wound care mechanisms and techniques. After obtaining more data, we plan to do a statistical analysis to assess for any significance. Here are our references, and thank you for listening to our presentation.